I love that program. Well, October is Sudden Cardiac Awareness Month, and more than 250,000 deaths occur each year as a result of the disease. But there is a growing non-invasive medical procedure that's being used on heart patients in hospitals around the country and here on the Sun Coast. Here to talk about it is Dr. Clayton Bredlau. And let's talk about, first of all, heart disease. What causes it, and why is it so prevalent?
Well, for the purpose of this discussion, basically we're talking about the buildup of cholesterol in the coronary arteries as well as throughout the vascular system of the body. And those blockages in the coronary arteries can cause chest pain and heart attacks. And we're going to talk about EECP, which is a method to treat that non-invasively.
And let's talk about that. Explain what that is.
Well, EECP is a non-invasive technique to treat patients that have chest pain from narrowed coronary arteries. It's a process where the patient lies on a comfortable table and they have inflatable cuffs wrapped around their calves, their thighs, and their buttocks. And these cuffs inflate in a sequential manner from the feet up to the buttocks, which is timed with an EKG. The patient has an EKG on, so that the heart pumps the blood out, and then these cuffs inflate and pumps the blood back to the heart. It basically increases the speed of blood flow through the arteries, which is it's just been fascinating in the last 20 years what we've learned about atherosclerosis. The faster the blood flows through the arteries, it creates a shear stress on the endothelial cells that line the walls of the arteries, and the endothelial cells then produce a substance called nitrous oxide, which dilates the arteries. So this helps dilate the coronary arteries, and it also, the faster speed produces VEGF, which is a growth factor, which can cause new arteries to grow to get the blood around the blocked arteries. It reduces the patient's angina symptoms. They can reduce the amount of nitroglycerin they need. They can become more active.
And so if you weren't using this procedure, what would be the alternative?
Well, the other options are heart surgery or coronary angioplasty with the placement of stents, and of course medication. But some people who have already had heart surgery and have had stents placed are at a point where no further surgery or no further stenting can be performed. So these people often benefit from the EECP therapy. It's done in the office. There's 35 treatments an hour each, so it's over about a 7-week period. But they definitely benefit. The risks are minimal. It can be done on most any patient, and side effects are almost zero.
Well, that's awesome. Well, thanks for coming in to tell us about it.
Thank you.
And we will be right back.